Hi there and welcome back to Lecture 3. Here we will look at one of the most interesting causes for depression currently being researched, and that is inflammation. Current evidence is suggesting a link between depression and inflammation. Inflammation is all about our immune system, which is a myriad of molecules and pathways that fend against infection and keep us functioning optimally. Scientists used to believe that the immune system and the brain were completely separated by the Great Berlin Wall called the blood-brain barrier, a line of cells surrounding the brain that acts as a barrier to certain things in the blood. In fact, the brain and the immune system are intimately connected and has implications in depression. Let's delve a little deeper. Firstly, what is inflammation? So inflammation evolved from our ancient biology. It's our body's natural response to infection or damage. It aims to protect and repair us. In fact, it's perfectly healthy and we need it. Like if you get a cut on your foot, we get inflammation. It becomes red, hot and swollen, and then it heals itself. Just like inflammation on your skin, inflammation can also occur inside your body and results in certain molecules being released by immune cells and circulating around your bloodstream, acting as indicators that you have inflammation within your body. These inflammatory molecules have weird and wonderful names such as IL-6, interferon gamma, TNF-alpha, and CRP. But inflammation isn't just about when we get sick or injured. Our lifestyle factors can also create chronic inflammation, such as with stress, obesity, a poor diet high in refined sugar and processed foods, lack of exercise, lack of sleep, and much more. So what's all this got to do with depression? Well, we know that becoming sick, for example, can actually cause depressive symptoms because of the activation of the immune system via inflammation, which can make people have depressed-like symptoms. Notice when you're feeling unwell, you get similar symptoms as when you're depressed. You become tired, you get low mood, you even get a fever or a higher body temperature. Did you know that when you look at people with depression, they generally have an elevated body temperature, which also follows a similar day-to-day pattern as seen in infection? That is, it follows a diurnal rhythm. Furthermore, certain compounds such as zinc and iron also get depleted in depression, same as they do following an infection. And we can get an increase in inflammatory molecules such as CRP. We also know that following vaccination, we can sometimes see a very short increase in depressive symptoms mediated by the immune system and inflammation. But does that mean that every form of inflammation will lead to depression? Well, short-term inflammation is good. It helps and protects us and generally won't lead to long-term depressive symptoms at all. However, when our immune systems become overactive and the inflammatory response lasts longer than it should relative to the initial trigger, we can get something called chronic systemic inflammation. That is a prolonged and exaggerated response which can occur due to multiple lifestyle factors, including stress, lack of exercise, poor gut health, inadequate nutrition, and lack of sleep. Importantly, with regards to depression and mental health, psychosocial stresses can actually increase systemic inflammation as well. This systemic inflammation can have damaging effects to the body and the mind. It promotes depressive symptoms, changes in the brain, and affects our neuroendocrine function. Studies show that people with clinical depression have raised inflammatory molecules. However, this is just an association. But can we prove a causal relationship? That is, if we give somebody inflammation, can it cause depression? Well, current evidence is quite compelling in suggesting that it is indeed the case. There was an interesting study which looked at injecting healthy people with a part of bacteria which induces inflammation called LPS. The result was an increase in inflammation and a consequent increase in depressive symptoms, including social disconnection, anxiety, and lack of enjoyment of pleasurable things. And this correlated with the peak of the inflammatory response in their body. Furthermore, if the researchers gave them an anti-inflammatory agent at the same time as the initial injection, that is, something that counters that inflammation, they did not get depressive symptoms. In fact, they used omega-3 fatty acids, specifically something called EPA, which is a component of fish oil known to have anti-inflammatory effects. We know from multiple studies that high EPA fish oil, that is up to about 2 grams per day, can actually help alleviate depressive symptoms. All very interesting stuff. So how does inflammation affect the brain? Well, it turns out that the inflammatory molecules released by immune cells to talk to each other also talk to the brain. These pro-inflammatory molecules that circulate around the body during chronic systemic inflammation can actually cross the blood-brain barrier and enter the brain. Once in there, they can have direct and indirect effects on the chemicals and neurotransmitters implicated in mood, anxiety, motivation, and depression. These include neurotransmitters such as dopamine, serotonin, and noradrenaline. Furthermore, there's a part of the brain called the default mode network, which is involved in rumination or repetitive worrying thoughts, which is implicated in depression. Inflammation has been shown to actually change the brain by influencing this rumination center of the brain to increase ruminating thoughts. Interestingly, and on a slight side note, when we look at exercise, exercise has the ability to counter these damaging effects of inflammation in the brain, and in multiple other ways, which we will delve into in the upcoming course. But the big question remains, does that mean that all depression is due to inflammation? While it'd be nice to say that all depression is due to inflammation, unfortunately it's just not that simple, and it's likely not just due to inflammation in every case. We know that depression isn't just one phenomenon, and in fact it's likely only a small portion of people that suffer from depression as a result of chronic inflammation. However, it's an interesting avenue to be driving potential treatment or preventative strategies for depression, since we know that controlling systemic inflammation is also beneficial to our overall health and well-being, so the future in this space is looking promising. Although current scientists do believe that the immune system is actually involved in almost every case of depression, however, the relationship is complex and not linear, that it's not as simple as increased inflammation is always associated with depression. The truth is, treating depression is not going to be some quick fix magic pill, although there's no doubt that antidepressants can really help some people get out of really dark places. But we'd likely benefit from an integrative approach, which includes a multitude of lifestyle interventions that, in addition to having positive effects in the mind, will likely reduce inflammation as well, and generally increase our overall mind-body health. And with that, we literally have nothing to lose. Right, so now that we have a better understanding of depression, what it's all about, and the new research avenues being explored, I'd like to take this a little further. If this lecture series resonates with you, I encourage you to head over to the Our Mind page to check out our upcoming course called Modernize Your Mental Health, to delve into the evidence-based strategies to optimize your mental well-being, improve your mood, and increase resilience in this modern world. Please leave your comments below to let me know what you thought of this lecture series, and if you liked this video, don't forget to hit the subscribe button below so you can stay up to date with all the good stuff. Until next time, my friends, I wish you health in mind and in body.